Hi, Greg.
Hey, Robert, how are you?
Doing well, thank you. I think I have on the line one of my clients. Her name is Linda.
Okay.
Linda, are you there?
Yes, I am.
Hey,
Okay,
Linda.
Hi.
go ahead, Linda.
I have severe arthritis in my left hip requiring replacement surgery,
Okay.
which is scheduled for June 1st, 2023.
Okay.
It results in a high level of pain doing anything but sitting.
Right.
The pain prevents me from doing normal activities such as yoga, exercise, and just routine walking. My current medications for pain relief are tramadol, I take one in the morning, and Tylenol arthritis daily, and some essential oils that Robert will tell you about.
Okay.
And so on the essential oil side, I started Linda out with galbanum, which adjusted her pain slightly. We eventually brought in juniper, CRC, arthrocare, and fascial release, sustained inhalation. And I think we're doing that twice a day, Linda.
Yes, morning and night.
Okay.
Is there anything we can do to reduce her pain level until after the surgery?
Yeah. Like the issue is that it's bone on bone, and so any sort of movement, aggravates it and causes inflammation. I mean, that's the thing with either a bone, or excuse me, a hip or a knee, where it's bone on bone, is that it's constantly generating inflammatory material. So, so the galbanum brought, like, you're just having her inhale the galbanum?
Yeah, at the moment, and I think we can obviously go to a couple drops.
Well, we
internally.
do the galbanum. We put one drop 5 times a day on my wrist, and then we put 1 to 2 drops and gulp it in water morning and night.
Okay.
Okay.
Yeah. Okay. So, I mean, you have, I mean, you have an issue where you're just trying to buy some time until the surgery. The surgery is going to alleviate most of it. I mean,
Yes.
you'll wake up and you'll feel like there'll be the pain of the surgery, but that pain that you're feeling all the time will be gone.
Oh, nice.
And so, we just got to keep the inflammation down. And so, walking kind of isn't your friend right now. Like walking, anything like that, like the best kind of exercise would be something in a pool, something that offsets some of the weight. Anything that's weight bearing is going to be maximum irritation in this particular area. But you still got to be able to move, and you still got to be able to do things. And so if you're shooting for exercise, though, even if you just get like a membership somewhere where you can just use the pool for 3 or 4 months, that's ideal. But anyway, we'll move on from that. So with that, the galbanum, I mean, the other thing that you can always throw in just for like basic pain management is myrrh. Myrrh, like you could go 2-3 drops 2, 3, 4 times a day. I mean, you could increase the dosage of the galbanum to 2 or 3 drops multiple times a day. That is helpful. I would put her on like some sort of like anti-inflammatory, and here you could do black cumin internally. Even if you didn't want to do the essential oil, you could go to the health food store and get black cumin or black seed, and pretty hefty dosage. Like, if you're going to the health food store, probably 3 or 4 capsules daily. If you're doing the essential oil, 2 or 3 drops twice a day.
Okay.
That would be pretty good. One of the other ways that you can augment the pain is that birch complex would not have to be on the site. Like, it could still just be like on the wrist, or like rub a little bit on the back. You could do it like in a roller ball or something and just like kind of rub it several times. I mean, it's not going to completely knock it out, but it will take the edge off some of the pain. And then for the joint itself, you have her using, what is it, Arthritis, and then CRC.
Let me find my notes here. Arthritis, CRC, Juniper, CRC, Arthritis, and fascial release.
Okay, so the Arthritis, I mean, it is very good for detoxifying the tissue and everything, and I'd probably keep it in the mix. But the part of the issue is like the Juniper is kind of doing it, the Arthritis is kind of doing it, but the blend joint relief, you're going to keep the blood supply up in that area. I mean, it is bone on bone, so you're not trying to save the cartilage is gone. And so
Yes.
The thing with getting the blood there, you're still trying to keep some of the muscle from contracting quite as bad. And joint relief is about getting blood in and then blood out of the area. Because like sometimes it's either not getting enough blood in there, or the blood is stagnant and not moving. And so when I say blood, I'm also talking about lymph. And so
liniment or ointment?
I tend, like, you could probably do either, but like I tend to go ointment here a little bit, and the rationale is that when you put it in a base of alcohol, it hits the bloodstream and kind of goes throughout the body. Like it'll go deeper, but it will like move around. When you put it in an ointment, it really kind of holds the essential oil to that area and does like a little bit of a slow release as it separates from the fatty oil, the carrier. And so you tend to get more of the essential oil deposited in that particular area, in that joint.
Okay.
Yeah. And then the other thing, like it sounds like you're doing healing on her.
I have not yet.
Yeah.
But we could do that.
Blast that hip socket with green, orange, and red. I mean, just like sometimes if it's super inflamed, you do green, blue, violet. But the more that you keep the circulation up in that particular area, it does minimize the pain somewhat. And I mean, when it gets inflamed like this, and it's causing pain, and it's just every little activity, even if you have a good day, still like the activities of the week, the more you move, the more it kind of hurts. Part of what happens is that it's generating a bunch of inflammatory material, and that area is inflamed, but then eventually it becomes systemic. And once it becomes systemic, it's like that inflammatory material can end up in other parts of the body, and it doesn't really cause like a condition or something, but it's just like it'll settle like where, I mean, it kind of goes everywhere, but you'll feel it in your weaker spots. So like if you have a bad shoulder, all of a sudden it hurts more. If you have a bad neck, all of a sudden it hurts more. If you have a bad foot, all of a sudden it hurts more. It's just because there's inflammatory material in the blood.
So that acute inflammation becomes general systemic.
It becomes systemic inflammation. Yeah.
Okay.
And inflammation, like sometimes it's not even the inflammation, it's the inflammatory material. And the black cumin will reduce some of that. But this is where you would put in something like a free radical scavenger, and one of your best bets there, especially with this kind of long-term potential, you're having to buy time till June, which is not a long time, but it's still a long time. Like, what I mean? It's still 4 or 5 months away. And so if it was really super short term, I'd say let's throw some German chamomile at it and rotate her through it a couple of times. Here I would say helichrysum. you could do the black cumin, increase the dosage, and if that works, then that's good. I mean, really, comfort is the biggest thing right here. Like if she's comfortable, then it's good. But if the black cumin still isn't cutting it, I would do some helichrysum and like internal. Like it needs to be like 2 or 3 drops a couple of times a day. Sometimes like if they get really bad, like a really bad flare up, you could actually even switch that out for a little German chamomile or yarrow internally. But you know, you can still do some more complicated things. But the other thing that you could add to it, I mean, turmeric is always like a good thing to throw at this. Ginger is always a good thing. I mean, you can figure a couple of things out just to keep her comfortable. But there's also that thing, those enzymes at the health food store, the Wobazyme. I'd get a small bottle just to, you know, they're a little bit pricey. I mean, not crazy, but they're a little bit pricey. So with that digestive enzyme, you start with 1 in between each meal, but you can go up to, you know, 3 or 4 if you needed to. But like, I would start slow, go up to 1 and then 2, and just for 1, make sure that they're tolerated well, then 2, that it's doing the job. So instead of getting a big bottle, get a small bottle, make sure that it works. That way, if it doesn't, you're not out, you know, twice the amount of money or whatever. Like a small bottle, I think might be like $15 or $18 or something. And basically it will have a similar effect to the ibuprofen. And so you know, I would keep her on all her meds and just try to increase the potency. I mean, it sounds like she's only taking 1 tramadol a day, and tramadol is not even that strong of a painkiller. And so, like, if she's getting by with that, you might be able to add the Wobazyme and have it take more of the edge off. But basically, you're just trying to keep her comfortable until the surgery happens. And so, keep in mind too that like inflammatory material, I mean, that's a lot of lymphatic work. Like if you want to, even after the fact, at some point you just have to go through and do a bunch of lymphatic work, and you know, depending on how much of that inflammatory material settles in different parts of the body. One of the things that I always look at, like post-surgery with somebody with a hip replacement, is there starting to be digestive issues? You know, is there starting to be diarrhea? Is there starting to be a little bit of irritable bowel? You know, because the issue with the hip is because it's been bone on bone, it's thrown their gait off. You know, it's thrown off the way that they walk. And part of what happens is that the disc up between L2 and L3, and sometimes between L3 and L4 in the spine, will start to either wear down or wear down a little bit uneven. And so, are you having any low back pain, by the way?
No, not at all.
Okay.
And I'm still able to do some stretches in the morning that I do for my lower back and hip.
Okay, and they've x-rayed your low back?
No, not yet.
Yeah, I mean, I mean, if you're not presenting with pain, you're probably okay, but there has been wear and tear on that. I mean, anytime, a lot of times when people have like a hip issue, they go to the doctor and they're complaining about the low back, and then the doctor x-rays everything and then goes, it's actually your hip. And so you're ahead of the game that your low back is not bothering you. But still, you know, that pain and that achiness, you know, lymphatic work helps. Like some of the if I shoot you a picture, can you like let's show a picture to Robert for therapy. Give me just a second.
And while you're doing that, if you can, I'll ask a question you can answer when you get back from that. One of the things I've always wondered is, would Lovage Body Tonic be appropriate?
Yeah, but you're already doing the Arthritis, so it's got a ton of Lovage in it, so I don't know that you need to
We're
do
just, okay, we're doing that simply inhaled at the moment.
things need to be put on topically for the hip, like the
Okay.
inhaling isn't going to be strong enough.
Okay, so
Yeah.
so we wanted, what you're saying then, going back to the 4 oils we're using right now, and take out juniper, put in joint relief, applied to the joint.
Yeah.
Do CRC and apply it to the joint.
Yeah.
Arthrocare applied to the joint. Fascial release applied to the joint.
Yeah. I mean, the fascial release is you're really just trying to maintain like or deal with whatever kind of spasms or tension that might be there. And so the joint relief might do enough where you might not need to use it as much. I mean, I'd still kind of put it in the mix, but give me just a sec here.
Yeah, no worries.
I'm shooting you a picture. I'm a boy. I can only do one thing at a time. Okay, there you go. Okay, so when she's able to post this picture, we'll go a little bit farther.
Give me seconds.
Okay, so this like little picture you see, it shows like a pain pattern that runs down the leg, and this is a muscle called the tensor fascia lata or latte. Is it lata or latte? Like it makes me start wanting to say latte like I'm at Starbucks, but basically this like kind of turns into the IT band, which is a big tendon that runs down the side of the leg. And so you see the pain pattern there, but one of the things that it doesn't illustrate is this same muscle is actually part of what causes some of the deep hip socket pain. And so on that area where you see that little X, you're going to want to put something that's antispasmodic there, like marjoram, basil, petitgrain, pepper, something that's antispasmodic, because it's not just that the socket, because anytime you have like bones that are rubbing together, like, yes, that is causing inflammation and everything, but the pain isn't coming from the bones. The pain is coming from the soft tissue, right? Like bones never generate pain. It's the tissue around it. So you're wanting to figure out like, where is that pain coming that's deep in the socket pain? And this is actually a big piece of it right here. And it's like right on the outside of your hip, but like all the way forward, kind of like if you follow like the top of the hip bone and you get all the way to the side and just drop down a little bit and you start poking around, it'll be real tender. That's the spot usually. And so if you're not sure, just cover that area. But, putting antispasmodics there will help to reduce the tension and then potentially reduce the pain that's deep in the socket. Manipulation wise, what we'd used to do is like we'd put the leg up on a ball and then rotate the leg like towards the other side of the body, so you're kind of stretching out the hip a little bit, and then use your thumb or something to like push on that spot, and then you would hold it for like 5 to 10 minutes. Like you would hold it for quite a while, and it would buy them like maybe a week of like reducing the pain, and then you'd have to do it again. Doing it with the essential oils, you can apply it daily And, it's not quite the same as doing the manipulation, but done daily, it will take the edge off. And, the thing here is you're trying to stack as many things as possible, trying to take the edge off so that life is comfortable until it's surgery time,
Mhm.
Back
Yes.
in the old days when it was bone on bone, it was just like, okay, it's time to just sit for the rest of your life. But now this surgery, they have it down. They are so good at it that, like I said, as soon as you wake up, usually it's like there's the pain of the surgery, but that pain that's been there for so long is gone, and it's so a lot of the same things we're talking about. Helichrysum would be put on the incision site post-surgery after the incision closes, just to reduce scar tissue. Joint relief would still be put on the hip socket, post-surgery, just to keep increasing blood flow, help the muscles respond. And usually you can hit the movement targets, like you try to walk so much within, the first week, first 2 weeks, whatever. Usually you speed that up by about 30% by constantly treating it with the helichrysum, the joint relief, and I still actually like to throw the blue herein on that area topically, just because it's so anti-inflammatory topically. Actually, it might not be a bad thing for you to even throw on now, the blue healer blend.
Okay.
I know I'm throwing a lot at you, but you're going to have to find
Find what does the best.
yeah, and it's not going to be one single thing. It's going to be like a series of things. There's
Okay.
that bone on bone thing, causes a lot of havoc. And so you're just trying to undo it. And everybody's a little bit different. That she's already doing better, like with not having low back issue. You can keep it pretty localized on that hip and be good with it. But I probably post-surgery, I'd even look at the low back and just treat it, even though there's not pain there, because the thing with an arthritic condition is spasms. Like if an area is pinched off, it can cause spasms that eventually turns into arthritis and breaks down the cartilage, which would be the discs in the low back. And even though there might not be pain present, because that hip's been compromised, you're going to want to reduce spasms in that lumbar area post-surgery so that it doesn't, in 5 or 10 years, cause another issue in the low back because of all the spasms in the low back.
Okay.
Yeah.
Okay, so if I can recap to make sure I got this right. Take the 4 oils that we're rotating, that we're using now daily, and apply them to the area instead of just sustained inhalation.
Yeah.
Take out juniper, put in joint relief.
Yeah.
Chronic healing wise, the hip green, orange, and red.
As long as if it's super inflamed, do green, blue, violet. But if it's not, then the more you can increase blood to the area, the better that area does.
Okay.
It's not going to slow down anything going on with the hip, but it reduces the pain somewhat.
Okay. Helichrysum, 2 to 3 drops twice a day internally.
Yeah.
Do we occasionally putting in German chamomile or yarrow for a day or two?
Yeah. You could go for a couple of weeks, like with those things, but also don't want to just be like piling on a bunch of things. But here you are having to kind of shotgun a little bit, just because you're keeping down pain, you're keeping down inflammation, you're keeping the lymphatic system moving, you're keeping blood in the area. You have like a bunch of things you're trying to manage, and it's just for a little while. But
Right.
Yeah.
Okay, so then also Wobenzyme, 1 tablet between meals.
Yeah. So you're doing that 2 or 3 times a day.
Mhm.
And a lot of times, like the combination of oils and the Wobenzyme will, I mean, there can be a point where it reaches a tipping point where there's just starts to be very little you can do, right? But
Mhm.
if she's already not having low back pain, you probably can scale the pain back somewhat. And
Right.
and so the Wobenzyme can be increased, but you know, if
Start
it's not
small and work up.
if it's not bringing tons of relief, then I
Okay.
just drop it, you know.
And then you said also one of the antispasmodics, marjoram, basil, pepper daily on the X on the hip and that muscle coming down the side.
Yeah.
Uh,
Just whatever you have. Like, you know,
okay.
marjoram, I mean, even helichrysum's antispasmodic, it's a little more expensive than marjoram. And like marjoram is usually what I use, but use whatever.
Yeah, we'll take care of that. If she wants to continue any form of exercise, move it to a pool, not any other form.
I would reduce, like, you know, the rule of thumb, like going into surgery is like exercise it so that it's not weak. But the issue that you have here is you're moving a weight bearing joint, and the movement itself is causing friction because there's no cartilage there, so you're bone on bone, and then it's weight bearing on top of that, so it's always going to generate inflammatory material and cause pain. Like, it's just like if you can do the movement where you're in a pool, you don't have the gravity pulling that down, and you're not having to hold the body up. You can kind of float and you can move the body around and the joints around, and it's not as irritating. It's still going to irritate, but it's not as bad. It's nowhere near as bad.
Okay.
And so and like sometimes where if it just gets bad enough, you just start trying to minimize movement.
Right. And
Just until the time. But you know, we had an employee here like several years ago, and he had the thing, and same thing, bone on bone, and you know, I told him like you probably like reduce the amount that you're walking, and he did the opposite. Like he decided like he was going to exercise it a bunch, and he started, instead of driving his car places, he would start walking places. And in a short amount of time, he went downhill. He was in a ton of pain. He was getting sick all the time. And it's just because like it just generates a bunch of inflammatory material, and you just,
Yeah.
there's nothing that you can do to stop it. And so you know, that idea of exercising before, I agree with it, except for like when it's a hip or knee, bone on bone. I mean, you still do things to be active and everything, but I would minimize anything excessive. And if you can, try to do things like where it's not weight bearing, or you know, I think I had one patient one time where she still wanted to exercise. So what she would do is like she would lay in her bed and put her legs up in the air and do like the bicycle thing. And, you know, she could move stuff around that way, but it wasn't weight bearing. And I was like, you know, whatever works for you, like, you know, but you know, the good thing is it's temporary because the surgery is going to happen. So you're really just trying to minimize the pain until the time comes.
right.
Correct.
Okay. So then also
The surgery is going to change your life, by the way. It's going to be life changing. Like it's usually immediate. You wake up and like,
Okay.
yeah,
I'm glad to hear that.
yeah.
So then the other ones you said, Greg, myrrh, 2 to 3 drops internally, up to 4 times.
You could do
a day.
myrrh or galbanum, like
myrrh or galbanum.
yeah.
Okay.
So, and can I give you like one more piece of advice? This is like
Sure.
in that time, like when you get the surgery. So go around the house, move everything up off the like low, move everything high.
Oh,
You know, because you know, are they going through the front or they're going through the side for your hip?
side, I believe, or the
So
back. Do they ever go through the,
Yeah, like more like back-ish, but
yeah, I think
but-
that's
or
posterior. Yeah.
yeah. So you're probably not going to be able to bend very much for a little
Oh,
bit.
Yeah,
The front, you can usually bend more right after the surgery, and the one where it's like in the side or a little bit posterior. Like if I remember right, you can't bend for like, I don't know, like a week or something. Like you have to be really careful. Like, I mean, you blend a little bit. So move everything up high,
okay,
and then like at the hardware store, like if you go to Lowe's, you know how there's those little aprons that they have for like work, doing a construction job where
yeah.
you stick like nails and things in the front.
Yeah.
You buy one of those, you put your phone, your tablet, like
Oh, okay.
all the little things that you would need in the day that you would get up and grab. That is like your new best friend. Like when
Okay.
surgery happens, like you're just every day you're gonna wear that, so you don't have to get up and move around. And then also, those extender handles that have like the little
Grabbers,
pads on them.
yeah.
Yep.
I have one of those.
Scatter them through the house. Scatter them through the house. Like just, it's going to be a rough couple of weeks, but like soon as you get through that, life is good. But make those couple of weeks as comfortable as possible.
Thank you.
And then black cumin 2 to 3 drops internally twice a day.
Correct.
Birch complex, you said applied anywhere?
Yeah, just get it on the skin,
Okay.
because it's going to hit the pain threshold and potentially help reduce that.
Okay.
It's also a lymphatic stimulant, so it should help offset some of the lymphatic like blockages.
Okay, and then the last one was blue healer topical, I assume at the area, at the hip.
Yeah, you would cover the whole hip, front, sides, back.
Okay, perfect.
Yeah, I mean, even if you only do half of what we say, it should bring some relief. But those are the things that I would shotgun at a situation like this.
Okay, sounds good. Linda and I will go over it and we'll keep you posted as time goes
Okay.
on.
Good luck, Linda.
Thank you
Thank
very
you.
much for all your
Yes,
help.
yourself.